important points about percussion. When you're percussing any organ, you're really looking for three specific sounds: resonance, tympany, and dullness. Dullness is a very short, flat, low-pitched sound that you would hear simply if you percussed over some muscle. So we can do that now. You barely hear anything at all. It's a very short, quick sound that doesn't last very long because it's short. The next sound we were listening for is resonance. Resonance is the sound of a chorus of low-pitched sounds throughout a tissue that is relatively hollow. It's not a hollow viscous, it's not a drum, but it is nonetheless airy and light. And that perfectly describes the chest, right? So let's take a listen to see what the sound of resonance sounds like. You'll note that my finger is typically, for most physicians or clinicians, you're hitting the distal segment of your middle digit. I'm keeping my other hands off the chest to avoid dampening down the sound, and that's the sound that I'm reproducing, which is the sound of resonance. In contrast, tympany is, since that also describes a particular drum in somebody's drum set, is a specific pitch. And you're typically looking for tympany when you percuss over a hollow viscous. The stomach would be the most obvious example. When you percuss over the stomach, you'll actually hear one pitch. It's a hollow sounding sound, and it tends to have a longer duration, and it's lower in pitch depending upon the size of the viscous that you are percussing. Maybe we should demonstrate that now as well. So this is the sound of tympany. You can tell it's a single pitch. It's hollow sounding and it's relatively long as well. Normally, the chest should only have resonant sounds, and we'll talk about what the significance is of finding sounds other than resonance in a moment. All right, now that we're back at examining the chest again with percussion, we're going to march down and compare one side to the other as we engage in percussion. And you'll note that right around here is the transition point where I go from resonance to dullness, which in this case would be me moving from above the diaphragm, where I'm percussing the lungs, to below the diaphragm, where presumably I'm percussing the spleen on the left side, and on the right side I'd be percussing the liver. So just by doing that simple technique, you can get a good sense of where the bottom of your lungs is located. You can imagine that if his lungs were full of fluid, or if one side was full of fluid, we'd have asymmetry where that dullness would occur much earlier on one side than on the other side. Incidentally, for some folks who may have very small hands or have trouble making a significant sound with this is called the plexor, this is the pleximeter, you can actually cheat by using a reflex hammer, like so. Makes a bit more noise if you need to create a louder sound. That being said, it's been said that it is much easier to tell the difference between something rather than nothing than to tell the difference between more and less. And I say that because if you hit too strongly with your hammer, you're going to get sound that's fairly loud throughout, even as you start going down towards below the diaphragm. So it's been suggested that actually percussing very lightly and noting where the sound really disappears altogether, something versus nothing, can sometimes actually help to create a more sensitive exam. But by all means, if you're in a loud emergency room, then using the reflex hammer can certainly help to accentuate that. And now the last part of the lung exam on the chest is looking for tactile fremitus. Fremitus describes the normal vibrations that are happening in the chest when somebody is speaking. And it's fairly subtle, but it's normal to have some degree of tactile fremitus, which is simply done by applying usually the ulnar surface of the hands, because that's where we're best able to detect vibration. And if I could just ask you to count to 10 for me again.
1, 2, 3.
So as he's speaking, and you can speak a little bit louder, Sean.
6.
I can clearly feel vibrations
8.
in my hands as I march up the back of his chest. In a patient who has, again, a significant lung consolidation, those sounds that are coming from his voice box, from his larynx, are now going to be accentuated as they pass through solid tissue, so you'll have increased tactile fremitus that'll be transmitted to my hands. In contrast, if he had an effusion in there, and remember, dullness to percussion is going to be the same whether it's in a fluid or if it's a solid. So dullness to percussion can't tease those two things apart. But if there's a consolidation, you'll have increased tactile fremitus, whereas if there's fluid, those vibrations from his larynx are not going to be transmitted through fluid, so you would have decreased tactile fremitus. And by having him speak aloud, I'll feel normal fremitus on one side, and I'll feel the absence of fremitus on the other side if that's where the effusion is located. Some people say that you should be saying the word 99. It honestly doesn't matter as long as this patient is speaking loud enough for you to feel fremitus.